Welcome to the Trauma-Informed Lens podcast. I'm your host, Matt Bennett. Each episode we talk about the research and practical aspects of the trauma-informed movement. This podcast is not designed to replace mental health services. If you feel uncomfortable or triggered by our discussion, please consider seeking your own trauma treatment. In no way is seeking treatment an admission of weakness. It is a chance to build resiliency and experience post-traumatic growth. You can find show notes, resources, and more at trauma-informedlens.org. Welcome, friends, to the Trauma-Informed Lens podcast. I'm Matt Bennett back here today. I want to first apologize for a couple weeks without a podcast. I've been traveling around the country training, and as most of you know, as we're recording this, there's been some interesting public health issues going on with the world as well. So I am so glad that I was able to get Dr. Eric Rossen to join me today. We were kind of going back and forth with our craziness, but I'm so glad we got to schedule this. Hopefully, if nothing else, this can give our audience a little bit of relief from what's going on in the world. So Eric, welcome to the show. I was really glad that we connected because I know we share a passion for trauma-informed, trauma-sensitive education. So I'm just thrilled to have this conversation with you to get my mind a little bit off the news as well today. So I'd love for you to just to give an introduction to our audience about a little bit about yourself and the work that you do.
Sure. Well, thank you so much, Matt, for having me. And like you said, this is a bit of a good distraction from everything that's happening in the news and around us. So my background is in school psychology. So I received my PhD in school psychology, and I started working in schools as a school psychologist, and I was doing some private practice work as well. And around, I think even my first or second year as a school psychologist in a large district right outside DC, so this is a large district in Maryland, I was getting regular referrals from teachers, from administrators, about students that were having behavioral problems, social emotional problems, academic problems, which is, all fairly common things for school psychologists. And of course, part of the role of a school psychologist or anyone when you're working with students is to start with some relationship and rapport building. And so I would have a list of questions I would always try to ask to get to know students. Tell me about your family. Tell me about what you like to do on the weekends. Tell me about a typical morning. Tell me about a typical evening. And I started learning that a lot of these students, and again, there's some of the schools I was in was highly transient. A lot of poverty in these districts and lack of resources. So a lot of students were on their own a lot and experiencing what some might consider objectively low degree but chronic stressors in their lives. But other students were experiencing chronic high degree stress. They were telling me about things that were happening in their neighborhood, in their personal lives, in their homes. And I started having a very difficult time reconciling the process in schools, saying that a student had a disability when they were responding to their environment in what I viewed as an adaptive and predictable way. The example I often give is, if someone's punching me in the face every day, do I have a disability because I have an anger management problem? Or is this a predictable and adaptive and normative response to that experience? So it was around 2008, 2009. I was in my second or third year of practice there. And I started learning a little more about trauma and some of that research that was coming out, which really hadn't infiltrated education in the school systems much by that time. And there really wasn't much out there. So a colleague of mine and we were talking with someone at the University of Missouri and asked us to teach a graduate course on trauma because we were talking about it. And we started looking for textbooks and we couldn't find anything. So we decided, well, let's use this opportunity to make one. And through that process, it was such a learning process, and it was multiple years, and we really dug into the research. And so that first edition of that book came out as from Oxford University Press. And since that time, it's transformed how I work with families, how I work with students, how I think school systems work, how I even respond to my own children as a parent. So it's a journey, it's a process, which I know, Matt, you say regularly, and you believe in that as well. It's been an illuminating one, both personally and professionally.
Awesome. So I would love to dig a little deeper in that experience of kind of going, and if you've never written a book, one of the great things about writing a book is you think about things in a very unique way. At least that's what I found. Yeah, I mean, even as a trainer, I can get away with some stuff, but when you're writing a book, boy, you have to be so concrete, make sure everything, especially in the academic world, that it's referenced in. And I just kind of wondered, as you kind of took that journey into really defining the components of a trauma-informed or trauma-sensitive school, what were some of the big insights, as somebody who started with some of this background, but I'd love to get some of the kind of insights and epiphanies that you kind of had on that journey.
Sure. So I will say that this particular book is an edited book, which is very different than a book that you author,
Yes.
that you are primarily responsible for the writing. And I'm just finishing one now on trauma-informed IEPs.
Oh,
and that
awesome.
is so I'm happy to talk about that later. But the edited book, it's a much different experience because you need to think big picture. And so initially, we needed to think about, we kind of broke it out into, there are systems components that you need to be thoughtful of. There are components around just summarizing what we know and writing it in a way that will make it also continually useful even 2 years after publication. But a big part of the effort, we realized very quickly, is the need to write information that empowers educators, even without a mental health degree, to be supportive of all the students they interact with.
Yeah.
And I think you said it well as far as balancing literature and research base with what's practical and embedding the experience and knowledge of extremely highly qualified teachers and special educators and administrators was something that took a lot of thought and many edits and revisions. I've found that a lot of people have said that editing a book is easier in some ways because someone else is doing the writing. I found the editing to be way more challenging than writing it because I get to just get to say what you want.
Yeah.
And you think about it a little differently. So we kind of created a structure, and we forced everyone to think about brief background, think about cultural considerations. So thinking about things through a cultural lens is incredibly important. I'll take a brief tangent on that. Like one example is when we talk about, like there's one chapter on domestic exposure to domestic violence in the household, and the impact of the cultural lens and that the individual perspective on and how that influences how trauma might manifest, or whether someone experiences traumatic symptoms at all. And there was a survey by the World Health Organization of multiple countries on whether domestic abuse is justified for things such as refusing to have sex with your husband.
Wow.
And the range was from 7% to 93%. And this is a survey of adolescent girls.
Yeah.
And so it would show that, at least in some countries, the experience of domestic violence and abuse will be perceived much differently depending on what's normative within that culture. At least that's a potential influencer on that. There are multiple influences, as you know. So we tried to build in structures of things like developmental considerations, cultural considerations, and then building in just simple strategies. So one example is we have a chapter on supporting students with parents that are incarcerated or caregivers that are incarcerated. And one strategy we said was, try to know when visitation day is, and if it's their first visitation, help them research what that's going to be like. What is their parent going to be wearing? What should they wear? Will they be able to hug them? Will there be a timer? Will there be a guard watching them? Are there things they should or shouldn't say? Can they bring in toys? Just helping them, look on Google Maps and see what it looks like from the outside.
Yeah.
Just help them prepare. Simple strategies that just empowers, like, I may not have a mental health degree, but I can still support the mental health of students with trauma history.
Awesome. Well, and that leads me to one of my favorite questions whenever I hit talk about trauma-sensitive education, as I have a wife who is off for a few weeks because of the virus, but is crashed out and passed out on the couch, as probably most educators are around spring break. Is, one of the things that I really appreciate is how already overburdened our educators are. And I really try in my trainings and also in my writing to say, boy, it's really in some ways almost unfair to put one more thing on an already overburdened educator and really an educational system as well. So, I wonder your approach as somebody who's, in the school supporting, bringing this paradigm into education is, you've got teachers who oftentimes have I call it a flavor of the month, where there's a new politician elected and they have their program. There's a new curriculum going on. They're told already what they were doing last year is wrong this year. And then we come in and talk to them about, hey, those kids that you kind of thought were making choices based on the consequences and punishments, not really. That whole theory is kind of in many ways blown out of the water. How do you support, an individual educator? And if you want to take it up even, I'd love to hear it as sort of an overwhelmed school in some ways, start to really rethink the paradigm around behaviors and also why some kids struggle learning as well.
Yeah, I think there's multiple components to that. And I will say, as a plug for an earlier podcast you had, I know you had a few podcasts on kind of systems and process, and I think you touched on some of this, and I think you did so pretty well. So for any listeners out there, check it out.
Thanks.
But one of the things I often want to be sure to say when I'm presenting or working with teachers or presenting to a staff is, first, acknowledge the things you're doing well.
Yeah.
And many times the instincts you're doing and the things you're doing without actually realizing it are supporting the social and emotional and mental health needs of our students, asking how their weekend was, taking a personal interest in their lives, just making personal connections. That goes a long way. And I think it's easy to ignore the things that you're doing well. And so a lot of times I try to focus on how are you doing this in an effective way. Mm-hmm. Secondly, there are times where I try to think about, I talk a little bit about discipline, right? And kind of the structures that are in place, and sometimes those punitive experiences where you get into power struggles, for example. Take your hat off. Student doesn't take their hat off. Suddenly you're in a public power struggle in front of the whole class, right? Or a student curses at you or says something in front of others. One of the things I always try to create a mindset for, and I've actually even told teachers to actually write this on their desk, and I've had it in certain places in my life. It says, it affects me, but it's not about me.
Yeah, I love that.
And that is it's a commonly used phrase in psychology, right? Mm-hmm. That there are things in your lives that life that affects you, and sometimes it feels extremely personal. But even a student that says F you to your face, a lot of times, and I've been in those situations where it's been helpful to say, you know what, this isn't about me right now.
Mm-hmm.
That allows me to remove my subjective emotional response and be more thoughtful in how I'm working with that.
Mm-hmm.
But I think lastly, a big thing I try to say is, at its core, it is being in trauma-informed is in a way a shift in perspective at an individual level. It's partly how you think as much as what you do and how you do it. And that there are system structures that enable you to do that better, and that will empower you to be more effective and to develop a team to do that. But there are things you can do individually that just thinking differently about the students. I actually tell a lot of teachers it will actually free you from the emotional burden of anger and frustration when you realize that a lot of these things are physiological, they're biological, and they have nothing to do with you. You're just you're just there. You're the safe adult.
Yeah. And I think that for me, because it sounds like we share a little bit of our similar background. Like I grew up professionally in juvenile justice before moving to child welfare. And so it was kind of a crash course on, this probably isn't about me, but it still took me until I started to really dig into initially the ACE study, and then the neurobiology really helped me following up that is, that this isn't a volitional, conscious decision to misbehave.
Yes.
There's not I woke up in the morning and wanting to get suspended from school today. And to me, that kind of coupled with, how do we keep ourselves healthy? Like you said, I think so beautifully, it's not about me right now, but it's also not a chosen behavior.
Yes.
Especially, for the kids with trauma, with that prefrontal cortex that's struggling to regulate the amygdala. And those two things together, it's like, ooh, we can shift how we understand this behavior and hopefully how we can react to it as well, which I think is a challenge in the moment, because when somebody's telling you to go F yourself, we have to be incredibly mindful ourselves not to react to that person.
And we have to allow ourselves forgiveness for, acting inappropriately, and then just apologizing for it afterwards. One of the things we sometimes I talk about is, the need for skill development in students, right? The assumption that students have the skill to do what you're asking them to do, that they have the skill to regulate, that they have the social emotional skills to ask for help. And one of the things I often say is one of the skills that students need help with is apologizing. Genuinely apologizing. And I think adults suck at apologizing too. And so, I've been in a position where I have, maybe overreacted even with my own children. I just raised my voice out of frustration or something. And I've had to actually think through this and be like, what they did was not intentional. They weren't trying to cause harm. And my reaction was inappropriate. And to go and just say, I'm really sorry about how I reacted. You didn't deserve that. And that was more about me being frustrated and not about you. And that's still hard. That's still hard for me to apologize to a 6-year-old, and I'm a 40-year-old man. So, so I'm kind of curious on your view on the same issue from the early childhood perspective, because I know that's been a focus of yours. Children that are very young are, their challenges are, they can't articulate very well their needs. They express themselves more through their actions in many cases, especially students maybe with disabilities. So I'm curious if the same messaging works in that setting, or if it needs to be tailored a little in working with early childhood staff.
Great question. One of the things that, again, writing the book made me really slow down with the thinking, and I'll also give my wife, Sarah, a ton of credit on this, because she's living it in a room of 25 first graders every day. So I'll give a lot of props to her on this. But as we were sort of thinking about this and bringing in the knowledge I have on the psychology and biology and her amazing classroom experience, you know, part of it is what we really, some of the insight was really slowing down a lot of times. I mean, you sort of mentioned the expectations of helping someone set the expectations for visiting a incarcerated family member. One of the things, and obviously this is a different twist on that, but one of the things that we really realized, and I've done work in special education as well, which really made me pay so much attention to transitions and how we really expect, sometimes without thinking through it very well, you know, what is the state that you need at recess? So what's the emotional, biological, psychological state that we allow you to exist in recess? And then we expect you to walk through the door and transition and then do math. And how do we set that up to be successful? Or in the older grades, how, you know, I spoke at a high school last week. Boy, being in the hallways of a high school is so overstimulating for me, even to today.
Like, oh my gosh.
They're making out. I think there's a drug deal going on over there. Somebody's crying in the corner over there.
Yeah, and there are people who are much bigger than you.
Yeah.
It's terrifying.
And so I think this applies whatever settings we in. I think we can always rethink transitions, but how do we help kids understand what are the expectations for the next half hour, you know, and how do we really slow that down? And especially in the early education setting, but I even think this like with adults in residential, I think sometimes we think, oh, they're adults, they can do this. But then how do we give them a time to check in with themselves? So, you know, my wife uses zones of regulations as a tool of, it's this simple kind of red, green, yellow, blue, yep. But real simple language of checking in on themselves. Because when I worked with special education, I ran a school for dually diagnosed developmentally disabled children. So basically our kids IQ under 80 and they were too violent for the public school system. And so what I really learned from the nonverbal kids was, if I can't tell you that I'm pissed off at you, I'm eventually going to punch you in the face. And nothing teaches you as a professional quicker than getting hit in the face a few times. And yes. So what that taught me is,
like Mike Tyson's famous quote, right?
Yeah.
Everyone's got a plan until they get punched in the face.
Exactly. And so it also really helped me because when we gave them the ability, we called it the I'm pissed off card they could pull out. So they could pull out the I'm pissed off card, and we would give them space. You know, we'd still have expectations, but we would give them some time to calm down. And so I really realized that even adults, we have trouble really taking a second to say, okay, how am I doing right now? And so that, to me, that combination of really making sure that the kids know here's what's going to be expected, maybe even be a part of setting those expectations for the next small period of time, and then giving a check-in so the teacher also knows is, hey, I've got 3 kids on red right now. I may start the lesson, but I know I need to check in with them individually here really quickly. And then if I've got half my class in red, I also might want to do some mindfulness activity as well. So in some ways, really being paying attention to building that kind of insight and understanding of self in a whole different way. And again, like you mentioned, those expectations play such a critical role as well.
Yeah. One thing I often talk about too is the need to acknowledge that expectations from adults in their lives are often extremely different. Absolutely. From home to school. And then within the school day, like you said, the expectations are vastly different from one minute to the next, depending on the context. Absolutely. And there's an expectation from the adults that they have the regulatory skills to be able to shift as quickly as we can when they're 3, 4, 5, 8, 12, 15 years old. And that I'm not sure if that's reasonable for every kid. And And we just know that students with trauma history they have a higher likelihood of lower regulatory skills.
Yeah.
And so, they're at higher risk. It's not a sure thing that they can't do that, but they're at higher risk for having more difficulty with that, or being more draining for them.
Yeah.
When this is a total tangent, but I was reading this very interesting study about kind of cognitive control and self-regulation. So basically this concept that it's not only a skill that you can build, but it's also a task that tires you out.
Yeah.
And that you run out of it. So the concept, for example, is if you love warm chocolate chip cookies and I put one in front of you and you're utilizing your self-regulatory skills to not eat it. It's a bad idea. It's a bad idea. Over time, that will wear out and you will eventually give in.
Yeah.
And so there's sometimes I think we need to realize that there are certain students who are utilizing their cognitive control and they run out of it.
Yeah. Yeah. Well, and that's where I like, the great thing about trauma-sensitive or trauma-informed educational approaches is they're good for everybody. Like that's, we don't have to choose, which is, I think a really a different thing that most educational initiatives might say, we're doing this now instead of this. It's like, for me, if I'm doing a training in a school and I'm walking through a middle school hallway, I need to practice about a minute of mindfulness before I'm ready to cognitively engage as well. So it's like, I think it's a little easier in early education in elementary school because of the structure, but it's like, man, if we got all these kids coming out of the hallway in a middle or a high school, just giving everybody, including the teacher, maybe just 2 minutes to do some breathing and kind of check in. And I know that's a different classroom experience, and not all kind of secondary teachers and stuff will be used for that. But, I'm working with a lot of physicians that, when you jump from exam room to exam room, it's really good if you take a few deep breaths with your next patient. So you help them regulate, but you also help yourself regulate as well. So, and for the kid that's not struggling with trauma, but just came out of that same hallway, to really get present and regulated before the lesson, what we're doing is we're getting people more in that, prefrontal cortex and ready to learn. So it's like, this innovation that we're having here, I think really leads to some, I think, things like when principals say, why should we bring in trauma-sensitive schools? If you want if you want the hardcore answer, it's to help you improve your test scores, And granted, you feel good about everybody else, but it's really to help improve your test scores.
Yeah, you tie it to a metric that's useful. But so with early childhood, in fact, I just came across a study earlier this week. I put it on Facebook and my Twitter page on early childhood and the use of mindfulness and yoga. And they did an 8-week intervention, and they found better attention and behavioral regulations in the students. What was very interesting was they found that the early childhood teachers had a higher rate of multiple ACEs in their history and higher rates of post-traumatic stress than the population at large, which I found incredibly interesting. But the first part of that study, with teaching them that mindfulness yoga and kind of what you were saying with the need to self-regulate and to find a way to take a moment, I think one of the things that I often talk to teachers about and administrators is, a lot of times we ask students to take a break, or we have a place where there's a calm space. And we, again, assume that they have the skills to know what to do with that time. Here's 2 minutes. Here's some squishy stuff. Fix it. Versus actually teaching it as a skill. Like, this is how you use this. This is how you use this. This is what it feels like to be calm. Let's practice it. Let's give feedback on what it's like to calm yourself. That is a skill. And a lot of times we assume that if we have a a structure, a corner of the room with a beanbag and a squishy ball, that we've done our part.
Yeah.
And I think the same goes for teachers who are, I think, innately unselfish people.
Yeah.
And they are often altruistic and student focused. And I'm in admiration of educators that work with kids every day, and thankful, particularly for the ones that teach my own kids.
Yeah.
But I don't think it's even fair to assume that all the adults have the skills to know how to actually calm yourself down.
Absolutely.
And do that in 2 minutes.
Yeah.
That's really hard to do.
And I just want to really reinforce a point you're making here. And I think this is not just in education, but for listeners in the social service arena as well, is I love this movement of really looking at behavioral issues as lack of skills to handle that according to our expectations. And if we look at behavioral issues as not having the individual, whether it's an adult or a child, because too often we jump to demonizing parents who seem to struggle in our systems as well, is they just don't necessarily have built the skills yet to succeed in a very specific situation. And when we can step back and view situations like from that skill-based perspective, I just think it hopefully helps us not to put the label, and I know we don't do this intentionally, but the bad kid label is, hey, this is just a kid that we need to help build the skills to be successful. And boy, if you do that along the way, that's going to translate into so many different environments, potentially throughout not just their educational career, but their life as well. And I think that's just such a big insight that I love this movement in education that I hope really becomes the paradigm in which we all operate off of, because it's such a good, I think it fits so well with the trauma-informed perspective as well.
Oh, I mean, 100%. I had mentioned this work on the trauma-informed IEP piece, and a big part of that.
Please go in. I'd love to hear more about your thinking around that.
Sure. So I've worked on it. It's a book I've worked on with Dr. David Bateman, who is a special education professor at Shippensburg University in Pennsylvania. And, it's applying a trauma-informed approach to the IEP process. Mm-hmm. And we kind of cover it. We think of...
Can you just, for some of our listeners, can you just really quickly...
what is an IEP?
What is an IEP? Yes.
Yeah, so it's an individualized education program, and it is basically an illegal document that's created to support students in typically public school settings or any setting that receives public federal money in education, to support students with an identified disability.
Great, thank you.
And that could be anything from, speech and language to impairments to emotional disability to learning disability, autism. Mm-hmm. So, there's a whole process to it, and our approach was first everything from referral to writing the IEP, which has goals and how you're defining the problem. But we go everything into like the assessment process, the report writing process, how you conduct a meeting in a way that recognizes that usually if kids have a trauma history, the families are pretty stressed, and what it must be like to go into a room with a long table with 10 people you don't know, who's probably saying just only negative things about your child. Mm-hmm. So thinking through all these things, but a big part of it is when you're getting to identifying the issue. An IEP might identify, this child protests too much in class and argues. And that's been identified as the problem. And so, of course, the goal is going to be we want to reduce the amount of protesting that goes on. Whereas instead we say the child has difficulty communicating their views in an effective way. Mm-hmm. And so even just restructuring how we identify the problem means that our goal then must be that we teach this child how to communicate effectively. Yeah. And when we started talking about it, I started also thinking about my daughters, because we pulled some goals from actual IEPs where it said so and so will protest or argue 0 times per day with the teacher. That's the goal, because the problem was they protest too much.
Yeah.
And I remember thinking that, I have daughters that I view as strong and empowered, and I want them to continue to feel that way I want them to be respectful. And so to say you will never question anything that's told to you by an adult is not something I want them to learn, but I want them to question things in a respectful manner and know how to do it and when to do it, versus just saying, this is stupid.
Yeah.
So, right. But they need to be taught that skill.
Yeah.
And we work on that all the time, that try that again. This is how I think you should say what you want to say, or here's multiple ways to say that. So that is just another example about that skill building piece and structuring it as a skill deficit and not an act of willful disobedience. And so this Trauma-Informed Iep book has a lot of that same foundational belief in it.
Wonderful. And as somebody who sat in maybe 100 or so IEP meetings in my career, I welcome that addition to this thinking. I want to kind of ask you a 2-part question and just give you the time to explore both of them. The first one is really the connection between trauma and special education, because I've seen some research out there that kids with coming from traumatic backgrounds are more likely to end up in special education. I think the last statistic I saw that we included in the book, they're 2.5 times more likely to be held back a grade. And obviously that puts them more likely to get an IEP, also behavioral plans and everything else there as well. And as part of that too, as I know, we're both sort of share an interest in looking at California and what they're doing about universal adverse childhood experience screenings. And so as you look at taking this deep dive into the IEP process, are you kind of encouraging, whether it's the ACE study or a different assessment, an assessment of trauma being part of the special education assessment? And would you extend that out more universally in a school setting as well? So I'll start you out, because I know those are 2 big ones, the connection between trauma and special education.
So I'll start with that one. 2 very good questions and a lot to unpack there. I will say, for anyone listening, I hope you accept and expect that I won't have every answer for you. Just want to set that disclaimer right from the get-go.
Except when they buy the book. When they buy the book,
that's right. Buy my
answer.
Right. If it were only that simple. But so the connection between trauma and special education, I think, is somewhat evident as far as just a higher risk for identification for special education. I think one of the challenges, of course, is so within special education, that is governed by the Individuals with Disabilities Education Act, which is, for anyone in psychology, is totally different than the DSM-5, which is your Diagnostic and Statistical Manual for diagnosis and what you might see in the community. Within IDEA, there are 13 disability categories. And trauma is not one of them, or any of them, nor is it really included in any of them in the small print. So one of the challenges, of course, is that there is no particular disability identification specific to trauma. Now, there's one mention of it in that federal law, which hasn't been reauthorized in 16 years. there's mention only in the infants and toddlers, but it mentions trauma only in the context of like family violence.
Yeah.
So of course, what you deal with is you have a student with a known trauma history come to your school, and they're referred to your team, and you realize that they're experiencing some social emotional problems, some behavioral problems. Do you say they have an emotional disability? Or is special education the appropriate way to get them services? These are difficult questions, and questions that I don't necessarily have the answers to. I think there are important considerations that need to be made. One thing that I often say is, if you're working in a school right now, being able to differentiate whether the trauma history is the sole cause of social emotional problems and behavioral problems versus whether that would have existed anyway, and how much variance did one contribute to the other. And I often say it doesn't matter.
Yeah.
It doesn't matter, because at least for now, we use a series of behavioral observations to help identify disability and students' needs. But as a part of that evaluation process, if you identify it as a trauma history, that should influence how you work with that student and the intervention plan. So, there is a connection, but there's not a direct one with the law. Now, whether reauthorization of that law, which may come soon, includes that, it will be hard to say. But for now, there's no like central home for it within IDEA. Now, there are some students that also receive services in schools through what's called the 504 plan. And this is actually covered under the American with Disabilities Act. And there actually are no limiting conditions within that. So I've seen 504s written for students with PTSD, and it's designed for that. I think, of course, one of the other challenges that we have in education is we may be working with students who are referred for a lot of the same reasons, and a lot of the symptoms of emotional disability or ADHD look a lot like what we might see for a student with a trauma history, that they may have a trauma history and we will never know about it in the school, right? The parent's not going to tell us, student's not going to tell us for a variety of reasons. And so this just goes back to the broad trauma-informed approach. Like you said, Matt, it works for everybody, and it's important because we can't assume to know all the details of someone's life, and we can't assume that if we ask them, they will tell us that.
Yeah.
So then that segues well into the assessment piece, right?
Small question in and of itself.
A whole question in and of itself. So for one, I think it's important to differentiate between trauma-informed assessment and trauma assessment. Because you can have a trauma-informed assessment where you are engaging in your typical assessment processes, but you are considering the potential for triggers in the setting environment, the family background and functioning, our own perceptions at the point of referral, student strengths, the questions we ask, how we interpret the outcome, how we involve and engage the family, predictable life events when planning assessments. So is it the anniversary of the death of a loved one, or someone was a natural disaster occur fairly recently? So we're engaging in our typical assessment practices of looking at maybe academic achievement and cognitive functioning, and just saying, are we being mindful of all the environmental influencers on the results of this?
Yeah.
So that's like the trauma-informed. And then there's the trauma assessment or trauma screening, which is looking at, the events and experiences and effects, right? A lot of times you've heard the 3 E's.
Yeah.
So right now, I would say if you had to ask me very quickly, and I'll give you kind of the abstract, I don't think we're ready for universal screening in schools, universal trauma screening in schools.
Yeah.
The research isn't there to support it, but there are multiple considerations, and there's a lot of reasons why. I'll go through some of them. Now, for one, there are many people who are advocates for universal trauma screening in schools, and there are many who are not. I will say one of the things that you always have to think about is, what is a worse mistake to make? False negatives or false positives, right? So a false positive is we identify a student that might have experienced trauma when they don't, or a false negative where we're saying, oh, they're probably fine, but in truth, we were wrong about the lack of a trauma history. A lot of times people will say false negative is a worse mistake to make.
Yeah, great point.
One question that often comes up is, what do we screen for? So, or do we screen just for ACEs? Do we screen for adverse childhood experiences, knowing that having adverse childhood experiences does not always mean you're going to have traumatic stress.
Right.
In fact, a minority of individuals that have adverse childhood experiences develop traumatic stress that has a negative impact on their functioning. So to make an assumption that ACEs alone would be sufficient, and the ACEs was not designed as a screener, and certainly not a diagnostic tool.
Right.
Or do we assess for individual reactions that might be trauma? Do you have nightmares? Are you ruminating on it and thinking about it regularly? So these are harder questions to ask, especially at a universal level. Now I know, so there's another thing about thinking about as a school, why are we screening? So are you using it to identify certain students? Is it to get broad data at the school level to make a case to advocate for funding? So we might say, we're not identifying anyone individually and it's totally anonymous, but we know 80% of our kids had experienced adverse child experiences. 50% of them experienced post-traumatic stress. We need more help.
Yeah.
So thinking about what is your intent? Parent consent is another issue. We know from surveys that asking for active consent versus passive consent can change the levels, and you're going to get a self-selection bias. If there's a parent who is the source of stress in the kid's life, they're not going to consent to it. Yeah. So are you getting an underestimate? There's a question about who will actually fill out the survey.
Yeah.
Is it the teacher? Is it the caregiver? Is it the student? We know from behavioral research and behavior rating scales that the agreement between students, parents, and teachers is very low. And when you ask a parent and a student the same questions about that child's stress, the parent is likely to underestimate the amount of stress that they're experiencing.
Yeah. So
there's multiple other considerations. Do you keep it anonymous or confidential? What do you do with the results? So, do you have a team in place to analyze it and plan accordingly? So I just think that schools, and many schools, have started doing this kind of ad hoc. We're going to take the ACEs screener and add a question about, one other thing or two other things, and there's this kind of build your own process. I think it's potentially problematic for schools to engage in that right now. And there's some recent research on these trauma screening measures that their validity and reliability are not as good as they should be from a statistical point of view. Yeah. So a lot of caution. I wouldn't say don't do it, but there's a lot of thought that needs to go into it and a lot of caution.
Absolutely. And I challenge a lot of schools because I get asked that question a lot as well. I get that asked for health clinics and in pretty much every realm that I step in. And I have a very similar response to you. It's like, you need to really sit with this question and think through all the variables in it. And with schools especially, if we think about that, what happened to this kid, right? If we make that from what's wrong with you to what happened to you, I know it's kind of simple, but hey, I think we got a lot of room to still work with that paradigm shift is, could you list off 100 kids in any school who you would really worry about as far as, a very simple, and it's, as a trainer, you always try to find ways to express complex things really simply, but hey, start at the kids that are going to your principal's office each and every day, and start to ask the question, is there something more happening with this kid that is behind this behavior? And even that is a tough thing to then move forward with. But I think
Sure.
just having the conversation, instead of just jumping right to, you had a bad behavior, how are you going to fix this behavior? Really that deeper dive into having an empathetic conversation with these kids. The thing I worry about with that is we'll sort of get the fight or flight amygdala kids pretty well with that. Is we kind of miss the freeze parasympathetic kids a little bit with that as well. But again,
exactly.
Do you have the mental health support to even deal with the kids that you could identify? Just list off the kids that you assume are struggling with that. So I think we have a lot of work to do.
We have a lot of work to do, and there's some new guidance that came out about universal screening that we should coordinate assessing for kind of negative attributes or deficiencies with strengths at the same time.
Yeah.
And have you heard about the Benevolent Childhood Experiences Survey?
Yes. I've seen that start to boil out. I used to call it protective factors, but hey, if it's
correct,
more catchy,
you're right, exactly.
Catchy. Yes.
Got to put your new copyright stamp on some new surveys, so I get that.
Exactly.
And I like the ACE and BCE.
Hey, good for them.
But yeah, there's so many ways too. I think you said that you can, what you said is identifying some students, that maybe have a lot of behavioral referrals. One great idea I've heard before is that the staff get together and they list all the students by grade.
Yeah.
And each individual goes through each student and puts a mark next to a student that they feel they have a good personal relationship with.
Mm.
And they find the students that have no marks next to them.
Yeah. Oh,
and they say, we need to do better with these students.
Yeah.
And then you assign a teacher to just reach out and just start to try to connect with that individual.
Yeah.
And a lot of times what you find is the students that are in the principal's office a lot actually have good connections at the school. Yeah. They, over time, by being there so much, they develop a good relationship with the front office staff. And I remember as a school psychologist, I had like my buddies and my friends in the school that were always in trouble, but we just got along well. And sometimes we need to worry about, like you said, the parasympathetic ones that are kind of under the radar.
Yeah. So just one more question as we kind of hit our time. We'll have to get you back on because there's about 6-7 more questions I do want to ask you. But have you, this is sort of an inside baseball question a little bit, but I got to ask it to you before I wrap up. So are you advocating for bringing trauma assessments into the IEP assessment process specifically? No. Or is that on an individual basis or not?
That's on an individual basis.
Okay.
So correct. What I advocate for is that we do a very thorough understanding about the background and the history of the student, that we ask good questions, that we engage the family in a non-threatening way, and in a safe way that makes them feel comfortable, which is easier said than done. And then, if there's a need to actually go further and investigate that, then that can be determined at an individual level. I think one thing important with screening, and I know you would agree with me, but I think it's important to say, is that screening should never be used as a diagnostic tool.
Mm-hmm.
So screening is just that, is to identify those that may need additional follow-up. Yeah. And so, in a lot of ways, when the student has been referred and they've already made it through that, that checkpoint, and then you're working with them, and as part of the interview and looking at records and learning about their background, you can view that as a screening in some way. Additional follow-up may be needed. So a long way to answer your question, no, I'm not advocating for every student receiving some assessment on trauma.
Okay, great. Well, why don't we make a deal here? When you get that book published, why don't we have you back and
All right.
I
Well,
guess
it's next month, so be
okay,
careful
okay.
what you
Well,
wish
don't
for.
don't tempt me because I've got a lot of system questions. I feel like we at least have another hour. I want to talk about supporting teachers and
Yes.
advice for parents. So maybe that's not even too soon. So let's at least you and I will reconnect when that's coming out.
That's
But
that's. I'm with you.
all right, because yeah, I think we're leaving a lot more on the table here. So, how could people get a hold of you? How could they learn when the book's published? Give some folks some information about how they might get a hold of you.
Sure. So I have a website. It's just ericrossen.com. So it's ERICROSSEN.com. The second edition of the trauma book, which has 21 chapters covering everything from background to secondary traumatic stress to strategies to even a chapter in there on from two architects on school design,
So
trauma-informed
important,
school
yes.
design. Very cool stuff.
Yes.
That's from Oxford University Press. I linked that on the website. And then the
Great.
new book is coming out next month from LRP Publications. So that'll be on my website once it's there. And so my contact information is on my website. And reach out to me anytime if you want to chat. And I just want to just say thank you so much to you, Matt. I think for having me, for engaging in such a interesting and fun conversation, in having this podcast and this outlet to begin with, which I enjoy listening to on my car ride, on my commute.
Thank you.
And I hope we stay in touch. But this was a lot of fun. So thank you for all you do.
Great. Well, like I said, we left way too much on the table not to reconnect in the near future. So, and I'll get all Eric's information, throw it at traumainformedlens.org as well. We'll throw that in the show notes too. So, yeah. So, Eric, I want to thank you. Like I said, I can't wait to continue this discussion in a future podcast. And I know we both wish everybody, please stay healthy. Take care of yourselves, your family. And I just got to throw out a lot of times we talk about people, and sometimes in education, my wife's off for another week, but I just always like to dedicate those folks working in residential treatment centers, healthcare that can isolate and are going into this disease and keeping people healthy and giving people hope in the midst of this. I just want to special thoughts and prayers to you all as you do this great work. So, and as a reminder, as much as you can, take care of yourself through this experience as well. So thank you. Thanks, Eric. And we'll see you soon.
Thanks.